Well, good evening, everyone. We're going to be respectful of everybody's time tonight, and we have a lot of information to cover. But just first and foremost, want to thank you all for joining and having your interest in what's going on, all things Paradise Point and COVID. Yay! Boy, isn't there a lot going on? It's changing on a daily basis, but we hope that this evening we'll be able to help answer some questions and be able to give you some clear direction on where we're coming from and our resources that we've been using. But first, I just want to move around our three teammates right here real quickly and introduce ourselves, and we'll go ahead and get into some housekeeping, and then we'll jump right in. First, I'm Marty Beck. I'm the Executive Director for Paradise Point Summer Camp, and it's nice to be here with you this evening. Megan?
I'm Megan Kittredge. I'm the Camp Director for Paradise Point, and I second Marty at being grateful for y'all for joining us today. I'll pass it off to Donovan.
Hi, I'm Donovan Kay. I am the Assistant Camp Director, and I am also glad you're all here.
Very good. Thank you, guys. Just a little bit of background real quickly. I hope you all know, but I'm pretty sure that as you started to show your interest in sending your campers to Paradise Point, or any history that you've had with Paradise Point, you may be aware that we're a ministry of the Episcopal Church in Idaho, and that we're an American Camp Association accredited camp. The Episcopal Church provides some guidance along the way, but ACA really is the American Camp Association is our primary accrediting body that provides a general amount of wealth of resources and information in all forms for our safety and our operations and the program here at Paradise Point, as well as site and facility standards. But specifically around this call, they've been an incredible resource for us in how we're moving forward with safe camping in our COVID summer. Our COVID safety protocols are in accordance with the CDC as well as the ACA, and also in direct communication with our local health officials, both at the Central District Health and in conjunction with St. Luke's McCall Memorial Hospital here in McCall and their guidance. Paradise Point camp staff have been in communication with all of those systems and their representatives, and we're creating and formulating our protocols based on best practices that they're able to offer us and what we've been able to really use in terms of our relationships with the American Camp Association, the CDC, and those local health officials. So I'm going to turn it over to Megan, and she's going to be able to take us into our specific topics that we'd like to cover this evening.
Before we get into that, I just wanted to bounce back to a previous slide and just, if you have any questions throughout this presentation, feel free to type them in the chat. We're going to get through a lot of information, so we're asking folks to mute themselves as we kind of barrel through. And then lastly, to continue to be kind to each other. We are doing this out of the care and safety for our campers and staff and greater community. And we just want to express some gratitude for y'all to understanding that. And so with that, there's going to be several COVID related topics covered this evening: how to prepare at home for camp, our testing strategy, arrival departure plans, keeping the camp bubble, our cohort model, and a little bit about our communicable disease plan, which is in place every year for Paradise Point for all sorts of illnesses, but it is especially relevant in the time of COVID. And I did want to note also that this information presented this evening is most specific to our youth camp programs. Paradise Point also runs family camps as well as guest groups. And today, for the purposes of this call, we'll be focusing on our youth camp program, knowing that family camps and guest groups may have some different policies or procedures related. So starting us off, Paradise Point aims to be leaders in the region regarding COVID-19 safety. We do know that other camps have their own protocols that are unique to them, as Paradise Point camps are unique to us. It is our firm belief that what's outlined here is the best way to keep our campers, staff, and community safe while fulfilling our mission of spiritual growth and leadership development through faith, fellowship, and fun. The protocols that we have in place are for two main reasons: for the safety of our campers, staff, and community, and to prevent a full shutdown of Paradise Point Camp's operation in 2021. In the summer of 2020, Paradise Point closed our operation for all groups at the behest of our local health officials, and we are grateful for their guidance as we bring life back to camp in 2021. But we can't do it without community support, including from all of you. So our approach to COVID-19 health and safety includes three main stages that are kind of outlined on this slide: prevention of COVID-19 coming into camp, monitoring and mitigation practices during camp, and care of people if they are unwell. And we'll go into a little bit more specific of how each of those stages look later on. Passing it
Thank
to
you.
Donovan.
Thank you, Megan. So one of the greatest analogies that we've had available to us is this Swiss cheese model. If you haven't seen this, it's kind of all over the place in our world right now. We've seen it posted all over the place. But basically, it's the idea that a multi-layered approach to COVID safety is the best way to go at it. Each mitigation effort, whether it's mask wearing, limiting social interaction, or getting vaccines, has its own imperfections, and each layer has its own, level of imperfection, basically. But by combining all of them together, we start to create a more solid wall of defense. So overall, we're increasing the success of preventing the spread. So we're going to start by talking a little bit about how you can work on, be part of our mission to prepare for camp at home. So Paradise Point encourages all who can be vaccinated against COVID-19 to do so as early as possible. Vaccinations are a safe, effective way to control the spread of disease. And you'll know that as we get closer to the summer, more information about vaccination and its availability for younger children will become available as we get closer to summer. And that's, we encourage you to keep on top of all of that information. As you're preparing for the couple weeks leading up to when your camper goes to camp, please stay home if you or your camper is ill. All campers, staff, and volunteers should recover at home if unwell until they are 24 hours without symptoms. And that includes being fever-free without the aid of fever-reducing medications. Everyone should monitor their health leading up to arrival at camp. Additionally, please limit the large gatherings that you're taking part in. Be mindful of your household's social interactions and use care when in public settings, such as wearing a mask or face covering, and practice social distancing leading up to the weeks before arrival at camp. We also know that many families will be traveling to camp, so please follow the CDC guidelines for safe travel as you get ready to head up to camp. And on the bottom here, you'll see that Paradise Point requires a negative COVID test taken within 3 days of arrival at camp. We'll follow up with more information on the next slide.
So one of the main ways that we can care for our campers and staff and our greater community at Paradise Point Camp is to require this pre-screen testing before arrival at camp. So as you can see on this slide, we've got our pre-screen testing here. All campers that will arrive at Paradise Point with documentation of a negative COVID test administered in the last 3 days. So if you're coming up on the June 20th, you'll want to have that test scheduled June 19th, 18th, or 17th. And you might want to check with your local testing facility for what their turnaround times are, so you're not caught waiting for those test results. And we're doing this because pre-screen testing is one of our best tools to prevent COVID-19 from entering camp and being able to quickly identify and isolate symptomatic carriers. We know that children are more likely to be asymptomatic carriers than adults. And we know that campers are traveling into camp from across the state and country, and even a few international travelers. Free testing is widely available across the country, and the CDC recommends pre-screen testing. The American Camp Association recommends pre-screen testing, and it's an important piece of creating the camp bubble. And you can see on the screen here, there are some kind of exceptions or one of these three categories. Essentially, we're asking all of you to bring a negative COVID test with you or a physician's note that your camper has recovered from COVID-19 in the last 3 months. We know that folks who are in that category may test positive for COVID-19, even if they have fully recovered, which is why we are not requiring a negative COVID test for them. Or documentation that your camper is fully vaccinated, and that includes 2 weeks out from the last dose. As of just today, I believe the Pfizer vaccination for 12 to 15-year-olds got approved for the United States. So fully vaccinated for people who can be is 2 weeks after the last dose, if a 2-dose regimen, or 2 weeks after the 1-dose Johnson & Johnson shot. So once a camper is in the bubble at camp, on day 4 or 5, Paradise Point will help them self-administer a COVID test. We're still working to figure out what kind of test that looks like or how that will look in action. We are hopeful that there are some over-the-counter rapid tests that are kind of coming down the pipe and that may be accessible to us to provide to campers. And we're working with Central District Health to figure out what the best testing strategy is, and they are committed to supporting us in this testing strategy. This mid-monitor testing will be shared with all of our family members, and this is a way that we can help make sure that if people were exposed to something during their travels or were asymptomatic, that we're sending campers home as well as bringing them into camp well. So this is about caring for the many communities that our campers are coming from. For example, if a camper came for a week of camp, they would arrive with documentation of a negative COVID test. On day 4 or 5 of camp, they would administer a test for themselves. And then if they were staying over to camp, they would if they're staying over at camp for a second week with us, and there's no need to do a second documentation. That mid-camp test is all that we would require since they're staying in the bubble. And you can see on this screen that we are pretty adamant that our bus riders must have documentation of a negative COVID test or one of the accepted kind of forms of documentation. What we've learned from Central District Health, as well as our representatives from St. Luke's McCall, is that eating, sleeping, and transportation are kind of our 3 areas that we're most concerned about as far as COVID risk comes. So that's kind of where we are focusing our controls at. So that means if people are taking the bus up to camp and they don't have their documentation with them, we will not be able to provide transportation for them. We are continuing to work to find all of the strategies that are changing on a daily basis, and we just want to again express some gratitude for y'all to understand that we are taking this seriously, and we are taking the health and care of our campers seriously, and that includes all of the things that are coming with COVID. So with this, how do you provide this documentation of your pre-screen test? Families can either upload online the documentation of their camper's negative COVID test or one of the other accepted documentations to the camper's UltraCamp account online, or bring a hard copy of the negative test results with them to camp. Either is acceptable. You'll see in your camper's UltraCamp account that there is like a little task bubble that needs to be completed. And Donovan has created a how-to video on how to upload that information that will be embedded on our Camp COVID-19 information on our website on that page, so that you'll have a video to follow along with, as well as you can always give us a call here at the office and we'll help you figure that out. We know that there's lots of different things that are going to be happening between now and camp, and we want to be a resource for all of you. So last thing on kind of this piece of testing is that the no-cost testing is available at your local health centers and at select pharmacies. Many are walk-in clinics that do not require scheduling an appointment. And you'll want to ask about how long the test result turnaround is to make sure that your camper has all of the results on arrival day at camp. So get-tested-covid19.org lists all the available testing centers near you. And we're doing this instead of partnering with a testing company because we know that there are people from all over the place, and we want to give you the option to select what works best for your families for this testing. And maybe that's at a Walgreens, maybe that's at your local health clinic or your primary care physician, whatever is available to you that you're most comfortable with. That's why we're building this way, is to give you and your families those options.
Megan, there's a question in the chat.
Oh, thank you, Donovan. So the question in the chat, will campers be tested on day 4 or 5, even if they are fully vaccinated? That's a great question, Dean. I think we would pass that back off to the local health officials to answer that. I'm not an epidemiologist, I'm a camp director, and I don't pretend to be an epidemiologist, but we would base that on what their recommendations were. So I do not know, but that is a great question that we will pass off to them and then respond back with what they let us know. Thanks. Okay, so once again, this testing strategy is recommended by the Central District Health, the CDC, the American Camp Association, our accrediting body, and St. Luke's McCall local health officials. So there are exceptions, like we've said, to the negative COVID test if a camper has recovered from COVID in the last 3 months, and if they're fully vaccinated, and our day camp program. Our day campers do not stay on camp overnight, and they only eat 1 meal a day outside. So we're not going to be bringing them into this testing strategy, but they will not ever interact with our overnight residential campers. So they are going to run their own program and their own cohort. And that, again, this is following the recommendations from CDC and CDH. So I've got a question in the chat here. I'm confused on the timing. If they arrive on Sunday, the earliest they can get tested is Thursday. That is correct. So if you're arriving on Sunday, coming in 3 days before that, get tested on Thursday would be the earliest. Kelly, you are correct. Day campers do not need to be tested. They're not staying overnight, which is, again, one of the bigger kind of risk factors in regards to COVID as a respiratory illness. And they're only eating 1 meal with their cohort, as opposed to 3 meals with our residential campers. So they're really limiting some of those kind of risk factors as far as COVID goes. So we will not require them to be tested. Also because they're going home and we don't control what they're doing for the rest of the evening or the day. So if we were going to test them, it would be every day, and that's just not going to be feasible for campers or for us. So we want to make this make sense, and we know that that's probably a little bit outside of our abilities, but that's a great question. Thank you.
And along those lines, the day campers won't be interfacing with the other group of campers. So it's not that we're inviting them in without testing them. It's that each group of campers will be within their own group, and we'll get to that pretty soon, actually. But it's not, they're not intermixing with the rest of camp.
Okay, so if a camper does test positive during the mid-camp testing, that camper will isolate in the King Lodge building in a room until an approved pickup person can get the camper. The cabin of that camper that tested positive will isolate as a cabin and continue to do their camp activities with increased mitigation efforts like masks, hand washing, and social distancing. We want to make sure that that camper or anyone who is feeling unwell is able to recover in the most comfortable place they can. For us, the most comfortable place is the King Lodge, and then the second most comfortable place is probably their home.
Okay, so thank you, Megan, for sharing all of that testing information. So when we've gotten through all of this test strategy, what we find is that we've now created a camp bubble. So this is our main mitigation effort to keep COVID out of camp. So once we have that baseline established, we will protect that bubble by only accommodating off-site trips if an entire cohort can remain together. So that means this year we will not be able to accommodate whitewater rafting trips, which would end up mixing our cohorts, or off-camp trips like the Bergdorf Hot Springs. Also noting that Bergdorf has closed its pool to people not staying in their rental cabins overnight. We're working to find substitute experiences for our campers. Protecting the bubble also means we won't accommodate visitors during our youth camp sessions. Visiting contract workers for our mobile petting zoos during Care of Creation will wear masks and be outdoors when working with a cohort of campers. Visitors are never allowed to be with campers without a Paradise Point camp staff. And a lot of those are standard procedures that we followed before, just with a little bit extra precaution this year, making sure that the people that we bring on the camp are there for intentionally and are aware of the procedures that we are following with our campers and our staff and volunteers. And then part of this camp bubble is our cohort model. So we'll use, basically what that means is we have multiple cabins that house between 7 and 10 campers each. And throughout the day, those two cabins will go through camp programming together as a cohort. So these small groups are about 14 to 20 campers in each cohort. And the cohort basically only mixes together when they're outside. Cabins are kind of the smallest group, and then the cohort is the biggest. Like we were saying before, the day camp program will be all its own cohort, and so will our leadership development program, like the LIT program and the SIT program during their first week of camp. Yeah, and that's it on the cohort model. Other mitigations that will follow will be temperature checks and symptom checks every day by camp staff for all campers. Masks and face coverings will be worn when indoors or within 6 feet of people outside of the camper's cohort. Outdoor activities will be prioritized, and we are strongly encouraging all of you to make sure that campers are packing accordingly. So that means that we might be outside when it's lightly raining and just powering through it. As the saying goes, there's no bad weather, only bad gear. So make sure you check the weather for the week leading the week of camp that your camper will be participating in, up to the very time that you either get in your car or are dropping them off on the bus. Because we all know that sometimes the weather can be a little bit fickle, but we're going to do our best to plan for all situations that we can. So it gets cold in the morning sometimes, get a jacket. It gets rainy some afternoons, so bring a rain jacket. And make sure you're packing a swimsuit because it's going to be warm sometimes too. And then on top of all of that, we'll have an additional hand washing station set up in front of our dining hall so that campers can wash their hands right before heading into a meal and hand sanitizer will be available at all entry points to all shared buildings. And then high touch surfaces and bathrooms will be cleaned and sanitized daily, which is the current suggestion from Central District, or sorry, the CDC, Center for Disease Control. Yeah, so those are a kind of an overview of our mitigation efforts. I'll pass it on to Marty to talk about our arrival and departure plans for coming to and leaving camp.
Thank you, Donovan. Really appreciate it. A few things that we'll see with arrival and departure. It's going to look fairly similar to what past years really look like. We're asking that people limit the number of people that are arriving on camp in vehicles with the campers that are being there to drop off, just coming up with those necessary to do the drop off and the pickups. And that we're asking all people to wear masks during their arrival and departure process. We do have a bunch of mixed people that are coming in, and it tends to become a little bit of a cluster and a movement around, and we want to make sure we can mitigate that as best as possible. Staff will be performing temperature checks and symptom screenings upon check-in, and that will verify the proof of the negative COVID test as we do the check-in there. We're also asking as normal, just to be able to make the departure and arrival process as smooth as it can be, is that we limit the amount of time that we have parents and guardians doing the pickup and the process, so that as more come in, that we can be able to send more out, and that will limit the cross contact and exposure that we have with our families. And I'll turn this back over to Megan to help explain a little bit about our care and disease plan.
Thanks, Marty. So every year and at all times, Paradise Point has a communicable disease plan, because we know that the flu, colds, all of those things are, they're not new this year, but it is especially pertinent to how we care for people if they're ill in regards to COVID. So this year we are reserving 4 King building rooms. Those are dorm style rooms during our youth camps that will be specifically reserved for the isolation of ill people. We will have an on-site healthcare provider available 24/7 during camp sessions, excuse me, to support the well-being of campers and staff. Campers who are unwell may be asked to recover at home or at the discretion of that on-site healthcare provider. So any camper or volunteer that tests positive for COVID-19 during the monitoring process will be asked to recover at home. Any staff that test positive for COVID-19 will have the option to recover at home or recover in isolation at Paradise Point Camp. And people with COVID-19 symptoms waiting on test results will remain in isolation. If parents want to come pick up their camper before the results are in, they're welcome to. And as the bottom here, as over-the-counter rapid testing becomes available, they may be used in assessing campers. There are several over-the-counter rapid tests coming to market that might be used, but those would want to be confirmed by a PCR test or lab test. But those are going to be helpful in assessing if a camper has a different illness or issue, or if they do have COVID-19. So we are, again, working in concert with Central District Health to see what their guidance on what our testing strategy for this mid-camp test should be. And so we will follow their guidance as they're able to give us all the updates on what the newest and latest and coolest things in testing are. Now I'm going to pass it back to Marty for a quick chat on our refund policy.
Thank you, Megan. If a camp session happens to be canceled, unlikely, but if it would be, it'd be terribly unfortunate. We'd draw from our experiences in 2020, and we'd be able to give all of our camp families the opportunity to choose the option that really fits their family's best needs. We have option 1, which would be a full refund, including the non-refundable fee. Option 2, a rollover credit to the next available camp session, or to next session next year. And or number 3, a tax deductible donation of the registration fees to Paradise Point Camp. All other cancellation and registrations will follow Paradise Point's traditional cancellation policy.
And then last, I wanted to share with everyone that the full information for and including a recording of this right now will be found on our website, paradisepointcamp.org, and under the About Us, the COVID-19 update section. And that's where we'll keep all of the information as up to date and relevant as guidance might change. We know that, and I'm sure you all know, as soon as we put some policy together, then something will change. So I just want to thank you all for understanding as we navigate. And I did want to share also that what is presented here today is what we think may be the most restrictive policies that we would run this summer. And as you know, we're all hopeful and have our fingers crossed that things will continue to improve. And as they do, or if they do, we will be able to roll back instead of rolling forward. So we know that things are going to change, and want to give you some, we'll be sending you updates probably via email as we get closer to camp with whatever those changes may be. I see a couple of questions here in the chat, which is great because we are just getting to our Q&A portion. So first I want to address Dean's question. Are camp counselors required to be vaccinated? We are not requiring the vaccination of our counselors or our staff at this point, and that's under the guidance of the American Camp Association. We are highly encouraging all of our staff to be vaccinated against COVID-19, and any unvaccinated staff will be monitor tested alongside our youth campers in that kind of weekly testing strategy so that we know that our camp staff are well. They also have kind of their own symptom and wellness checks that they'll be doing on their end as well. And then Jennifer, we did not chat about our family camps. This presentation is specific to our youth camp program for Paradise Point, but there will be more information for family camps coming out as we receive more and additional guidance from Central District Health and our local health officials as far as what family camps might look like. For us, the youth camps are kind of our biggest priority as far as health and safety goes, because we are responsible for the care and well-being of up to 100 young people at a time. And so that's where we want to focus our energies first, and then roll into our family camps and other guest groups. But we are working on it, I promise. And now's the time, if you have any other questions, feel free to type them in the chat, or you can unmute yourself. And we went through that very fast. And I know that that's a lot of information that we went really quickly. So if you have any other questions, now is a great time. Question from Allison, will the children be required to wear masks with their cohort? That's a great question. The only times that we are asking the children to wear masks are when they are inside or when they are within 6 feet of folks who are outside of their cohort. So this is a part of why we have that camp bubble, is to ensure that, you know, like this, all the layers of Swiss cheese, we're going to line them up so that we are forming a full wall of cheese. Oh, sorry, Jason, your girls will be just shy, so close, but I do appreciate all of the folks taking care of themselves and their families and our community and getting vaccinated. I personally am on Team Moderna, and I know that our director team is fully vaccinated, and we're excited to be able to be up at camp and enjoying it. A non-COVID question. All right, Kelly, what kinds of activities do the kids do in a day at camp? I'm going to pass this one off to Donovan.
So it looks like you're asking specifically about day camp, and day camp follows a lot of the same activities that we have with our with all of camp. So we've got a lot of different programs that camp offers. Some classics like archery, and then we've got hikes. We've got a lot of waterfront activities. If you've never been to the property before, we're on a peninsula, so we're kind of surrounded by water. So we've got our waterfront, we've got canoes, kayaks, paddle boards. We've got an inflatable obstacle course called the Wibbit. We've got a lot of sort of lower energy activities as well that we lead campers through, like team building activities, our low ropes that have, you know, a whole bunch of different little elements to building team communication, and then all kinds of other things of the arts. We've got arts and crafts, ceramics, we've got guitar, ukulele, and what is specifically offered every week kind of fluctuates based on what staff we have available that week and what their preferences are, but we try and make it a strong blend of all of the activities and programs that we have available.
And Dean had a question, and I just want to verbally answer it as well. Will the cohorts eat together? Yes, those cohorts of campers, so those 2 cabins that are going to be a little camp family and do all their activities together, will eat together as well. Typically, cabins eat together for most meals, and so this is very similar to what we've done in the past. and they may be eating with their cohorts as well.
And Megan, I might reiterate, as I read the question, Dean, maybe you're asking if individual cohorts mix with other cohorts while they eat. And those cohorts will go into the dining hall separately and more of a routine fashion with sanitizing happening between cohorts coming in, and then we all eat in respective areas that are outside of the dining hall.
Yes, our if you've been to camp at peak youth camp season, the dining hall deck is pretty packed. So we will be moving some of those tables to in front of the dining hall and some other areas so that we can expand that so that there is a greater distance between the tables of campers eating, so that we can make sure that our cohorts are keeping their own mini bubbles within the bubbles.
Good question, Dean. Well, seeing no others, obviously Megan showed the website that we have a lot of different resources, especially to the American Camp Association and the CDC, but also know that we're always available by email, contact through the Diocesan Center, and that we really appreciate you choosing Paradise Point as a place to send your campers, or if you're joining this meeting just to get a little bit of insight, we appreciate that you're willing to hear what we've been putting together. I'd really like to acknowledge that Megan and Donovan are really the masterminds of all of this. I'm impressed and assured at all levels that the research that's been going into this is of the utmost importance, but and the most up-to-date information that's coming across. Megan was just hearing just this morning on how our Central District Health is working with us to be able to find a way that we can do the testing and in any way we can. And that I'll reiterate what she said, but that this is changing daily, but know that as we go forward, we're going to be clearly communicating anything that we need to do with you all, and and reiterate also that this is the most restrictive scenario that we kind of foresee having to go. In all essences, we hope that this goes in the direction that we start to be able to reduce a few of these, but we'll communicate that all very clearly. We wouldn't change any of this and without notifying our campers and our parents and our families. So thank you all very much, and a round of applause for Megan and Donovan, but also know that we're available at any time you need us to be able to clarify any questions, and our website will have this recording. So if there's something that you missed or you joined in late, you can easily join in. It's nice to wrap up our evening with a little bit of time to spare to enjoy with your families, and so we'll let you all do that. But thank you so much, and please keep in touch and be safe and well, and look forward to seeing you this summer.
Thank you.
Bye, everyone.